Welcome to this iGrow podcast. I'm Dr. Lon Whitlow, Professor Emeritus at North Carolina State University, and today we'll be talking about moles and mycotoxins that may affect dairy cattle, and we'll also talk about their effects and ways to manage the problem when it exists. This shows a number of the toxigenic moles that occur in nature. These moles can occur in almost any kind of feedstuff. They include Aspergillus, Penicillium, Diplodia, and a number of different Fusarium species of moles. These mycotoxins produce a variety of mycotoxins. I've shown some of the more common mycotoxins here in this slide. The Fusarium produce mycotoxins such as deoxynivalenol, zearalenone, T2, and fumonisin, whereas the Aspergillus produces primarily aflatoxin, and this is a toxin that's affecting some of the drought-affected corn in the Midwest this year. We also have the Penicillium that produce mycotoxins such as ochratoxin, PR toxin, botulin, and mycophenolic acid, and we expect these mycotoxins to be most concerned in fermented feeds such as silage. Now, there are a large number of mycotoxins, so when we see or analyze for one mycotoxin, we indeed may have many other mycotoxins present in the feed. Currently, we know that there are about 1,000 different mycotoxins that have been identified, but we suspect that only 5 or 6 of these mycotoxins occur very commonly. There are a couple of different disorders that we can see with moles and mycotoxins. The first is called a mycosis. A mycosis is a disorder that results from the fungal infection, and the mycotoxicosis is a disorder that results from exposure of the poisonous effect of mycotoxins that are produced by the fungi. Exposure may be by oral consumption, by inhalation, or skin contact. Now, I'll show you an example of a mycosis, and this has been referred to as hemorrhagic bowel syndrome. In hemorrhagic bowel syndrome, Aspergillus fumigatus infects the intestinal tissue, and therefore the mold becomes a pathogen. Mycotoxins are a part of this toxic disease process, which suppress immunity and allow the mold to become infective. This slide shows the intestine, the necrosis that occurs in the intestine, the fact that you have a large blood clot that occurs within that intestine, and then examples of the infection within the gastrointestinal tract. We will cover a number of individual mycotoxins, including the aflatoxin, some produced by Fusarium, and then also the Penicillium. Before we get started in that, I want to show you some results from laboratories this year, the Rock River Laboratory and Dairyland Laboratory, indicating the incidence of 5 different mycotoxins in this year's corn and corn silage. First of all, let's look at aflatoxin on the left of this slide, and we can see that with corn grain, the laboratories have found between 11 and 12% of the corn grain contaminated with aflatoxin above the legal limit. Now, going down below that in the chart, you can see the incidence of aflatoxin in corn silage at between 8 and 13% of the corn silage above the legal limit. I think the point we want to make here, though, is these laboratories are also finding other mycotoxins in these feedstuffs. If we look at deoxynivalenol, 12 to 26% of the corn grain has been above 1 part per million of deoxynivalenol, and the silage between 20 to 52% contaminated with deoxynivalenol, again above the 1 part per million level. There's been a little bit of zearalenone identified at the Dairyland lab in corn silage. You see 24% of those silage samples showing positive for zearalenone. There's been very little T2 toxin, but Rock River Lab is also testing for fumonisin, and between 10 and 12% of the corn grain and corn silage has also been contaminated with fumonisin. Now we'll look at aflatoxin first because of the concern over aflatoxin in this year's drought-affected corn. Aflatoxin produces liver damage, hemorrhage, decreased performance, immune suppression. It is a carcinogen, and it also can cause a milk residue. We expect milk residues to be about 1.7% of the concentration that we find in the TMR. Now on the right-hand side of this slide, you can see that aflatoxin affects the liver, and there's an example of the fact that the aflatoxin causes cirrhosis in the liver. It causes cellular death. And the bottom part of the slide indicates that the aflatoxin itself becomes toxic as it's metabolized in the liver to the epoxy form of the aflatoxin. The FDA action level for aflatoxin is 20 parts per billion in dairy feed, and it's set at a half part per billion in milk. Again, the transfer from feed to milk is approximately 1.7%. Therefore, if we have 30 parts per billion in feed in the TMR times the 1.7% transfer, this would equal the legal limit in milk of a half part per billion. Now, for a margin of safety, we need to stay below 20 parts per billion in the feed, which is the legal FDA limit. If we have corn grain that's contaminated, for example, at 100 parts per billion, then we could use that in the feed at 20% of the diet, and the TMR then would contain the 20 parts per billion, which is again the legal limit, and would keep us safe from having a milk residue. The FDA action levels for different classes of livestock and poultry is shown in this slide. And while the legal limit for dairy, shown at the bottom, is 20 parts per billion, we can see that the legal limit for finishing beef cattle is much higher at 300 parts per billion. For finishing swine over 100 pounds of body weight, it's 200 parts per billion. And for breeding animals, breeding cattle, breeding swine, or mature poultry, the level is 100 parts per billion. Now, any immature animal is more sensitive to the toxic effects of mycotoxins, and we should keep the diets below the 20 part per billion level. Now, this slide indicates milk production loss associated with feeding aflatoxin over a 1 month period of time. And the important thing to keep in mind here is that if you stay below the legal limit of 20 parts per billion, then there would be no effect of aflatoxin on milk production or health of the dairy cow. This slide also indicates that it would take 100 or perhaps 200 parts per billion of aflatoxin to depress milk production. So as long as we stay below the legal limit on aflatoxin, we will not affect the cow's performance. This slide shows the effect of aflatoxin on beef cattle, and again indicates that to affect weight gain, feed intake, or feed efficiency, the level of aflatoxin in the diet would need to be above 300 parts per billion. Some management strategies, if we do find levels of aflatoxin in our milk or in the feed, we'll take example of the milk being high in aflatoxin. I think the first thing we need to do is try to identify the source of the aflatoxin, so we'll be testing feeds. Secondly, remove any positive feed. Now, because we believe that aflatoxin is most prevalent in corn grain, then it would be logical to remove the corn grain from the diet while we're doing our testing and try to replace that with clean corn. Then we need to monitor the milk for level of aflatoxin, because this would be the best way to know the amount of aflatoxin being fed. If we have a feedstuff that's high in aflatoxin, then certainly we can dilute that feed on the farm to reduce the level of aflatoxin fed to the animal. We can screen the grain, because most of the aflatoxin is in the dust, the fines, the broken kernels. by screening, we can reduce the aflatoxin level considerably. We can also use a feed binder. Now, feed binders in research have shown to be very, very effective, but they have not been approved by FDA for commercial claims. Another thing that's done at times is to ammoniate the feed. We certainly need to manage the feed storage, keep the grain aerated so we keep it dry and prevent additional growth of mold and additional production of any aflatoxin. And also keep in mind that any feed that is derived from corn may very well contain some aflatoxin. Again, things like corn screenings might very well have high levels of aflatoxin because most of the aflatoxin would be in the screenings. Products such as corn gluten feed or corn distillers could have higher levels of aflatoxin if those products were made from a parent supply of corn that contained aflatoxin. Now I've got some information here about ammoniation of grain. FDA has not approved ammoniation across the board, but it can be approved upon state request. Keep in mind that ammonia is hazardous and OSHA regulations must be followed. Ammonia is corrosive to metal, particularly galvanized grain tanks, so there's some real problems with utilizing ammonia. If you do use it, the grain needs to be between 13 and 16% moisture, and the temperature would be best to be above 60% Fahrenheit for good reaction of the ammonia with the aflatoxin. The application rate is between 0.5 and 1.5% anhydrous ammonia or an equivalent amount of aqua ammonia. Now, after the ammonia is applied, it needs to remain in contact with the grain for a week or two, depending upon the temperature. If the temperature is below 60 degrees Fahrenheit, then certainly we need to leave that ammonia in contact with grain for at least 2 weeks. A good brochure is available from the University of Georgia. It's circular number 885, called Treating Aflatoxin Contaminated Corn with Ammonia. This slide shows some research indicating how binders that bind mycotoxins may be used to reduce the milk concentration of aflatoxin in dairy cows consuming contaminated diets. On the left-hand side of this slide is the level of aflatoxin in milk, and on the bottom of the slide is the number of days in the experiment, from 0 up to 17 days. When we start this experiment, the cows have not been exposed to aflatoxin. They don't have any aflatoxin in the milk. We introduce that on the first day of the experiment, and the levels of aflatoxin in milk rise very rapidly. They plateau, the levels of aflatoxin in milk plateau, and will remain high as long as we continue to feed the aflatoxin. Now, in this experiment on day 8, we have introduced mycotoxin binders into the diet. And in this example, you can see that the control group of cows that continue on the aflatoxin with no binder will maintain a high level of aflatoxin in their milk. On the binder that's labeled NYO-C, there was no effect on milk aflatoxin level, so that particular additive was not effective in this study. And so the red line shows a silicate type binder that was added to the diet, and the level of aflatoxin in the milk declined very rapidly by 65% of the control group. There is a number of brochures available about aflatoxin. These are available from the USDA. If you go to usda.gov and search on the word aflatoxin, you will find a number of brochures available from USDA. Now, when you take samples of feed for aflatoxin, it's very difficult to get a representative sample. And that's because a mycotoxin within a feedstuff is not uniformly distributed. It may take only a very few kernels of contaminated corn in a bushel to cause an illegal residue of aflatoxin. So when we take samples, it's very difficult to get an accurate sample. And taking a sample of feed for mycotoxin analysis is represented here on the right-hand side of the slide and shows you how difficult it would be to get that good sample. 85% of the total error in determining aflatoxin concentrations is involved in taking the sample. Therefore, in a load of corn, you would need to take at least 12 core samples of corn, and the sample should represent about 10 pounds. That sample then should be mixed and subsampled before sending to the laboratory. Now, I want to talk about some of these other mycotoxins that may exist in this year's feed, mycotoxins that occur year to year and also affect dairy cattle. The first one is a fusarium-produced mycotoxin called fumonisin. This mycotoxin has been associated with a disease in horses called equine leukoencephalomalacia. It causes the deterioration or breakdown of nerve cell tissue, and I'm showing here on the right-hand side of the slide an example where the brain tissue has been necrosed because of consumption of fumonisin. So fumonisin affects lipid metabolism, it affects nerve degeneration, it causes liver damage in most animals, and in pigs it causes pulmonary edema. This is a study that we did with dairy cattle where we fed fumonisin at 100 parts per million in the diet compared to a control diet that contained little or no fumonisin. We started these cows in the late dry period and carried them through 70 days of milk, and you can see at peak milk production, the cows consuming fumonisin produced about 20 pounds less milk. Most of that was associated with a decrease in feed intake. We saw no symptoms of health disorders, but we did measure an increase in liver enzymes indicating mild liver damage in these dairy cows. The next mycotoxin is deoxynivalenol. This is often referred to as DON, and some people call it vomit toxin because it makes pigs vomit. This is also a fusarium-produced mycotoxin. It has been associated with the mold that causes ear rot of corn or stalk rot in corn, and also scab on wheat. Now, DON symptoms include things like reduced feed intake, digestive disorders, diarrhea, reduced performance, and weight loss. In the early 1980s, we were concerned about the effects of mycotoxins on dairy cows, and we did this experiment where we took 300 feed samples from 300 dairy herds and looked for mycotoxins. And we found in this experiment that DON was significantly associated with a reduction in milk production, and that at 1 part per million of DON in the diet, we might expect as much as 3 or 4 pounds loss in milk production. Now, DON itself is not a highly toxic mycotoxin, but it is a marker for the fact that the feed is moldy and may very well contain other mycotoxins. This is shown very well in this slide where DON was added to feeds, fed to swine, and in this experiment they looked at both weight gain and feed consumption associated with DON, pure DON added to the diets, and then naturally contaminated feeds that contain DON. The result was that DON does reduce weight gain and feed consumption in pigs, but it is not nearly as toxic as naturally contaminated feeds that contain the same level of DON. Therefore, the DON was acting as a marker to indicate that there were other mycotoxins in the feed that were as toxic or maybe more toxic than DON itself. The other point about DON and how it may affect dairy cattle is this research from Germany that indicated that DON, which is a trichothecene mycotoxin, interferes with protein synthesis. And in this study, they found that at 3.1 parts per million of DON in the diet, the metabolizable protein flow to the gut of dairy cows was reduced by 20 percentage units. They also looked at rumen ammonia levels and showed that the DON was associated with higher levels of rumen ammonia, indicating that the bacteria in the rumen were not assimilating that ammonia into bacterial protein, and this was a part of the reason for a reduction in metabolizable protein. The next mycotoxin is zearalenone. Zearalenone occurs along with deoxynivalenol. It's produced by the same mold. Zearalenone looks like estrogen, and the way it affects an animal is by mimicking the effects of estrogen in the body. The estrogen competes with binding sites within the animal, causing this estrogenic activity. Zearalenone, therefore, reduces reproductive performance, can reduce conception rates, can cause prolapse in sheep, reduce semen quality in bulls, and an accumulation of fluid in the udder of virgin heifers. And I'm showing a picture of a heifer that's never been bred. She was consuming zearalenone at about 700 parts per billion. This resulted in the fluid accumulation in the udder, and these animals generally will not breed, and they will get mastitis and they become culls from the herd. Now we'll talk a little bit about T2 toxin. T2 is a very potent mycotoxin, also produced by Fusarium. The symptoms are quite severe, including immune suppression, diarrhea, bloody gut, off feed, poor fresh cow transition, increased disease, and death. And the concern level for T2 in the diet is to have no more than 100 parts per billion of T2 present. Now I'm showing a picture of a cow on the right-hand side that has hemorrhagic bowel syndrome associated with the T2 toxin. And this demonstrates very clearly the irritating properties of T2, causing the gut irritation, the hemorrhage in the gut of the cow. There are also a number of Penicillium mycotoxins that we need to be concerned with. These include toxins such as PR toxin, Roca14C, mycophenolic acid, botulin, and ochratoxin. All of these have been associated with toxic silage and toxicity in dairy cattle. Now, Penicillium in some years is the most prevalent mold in corn silage and fermented feeds. And this is because Penicillium will grow at a low pH. In this research from Penn State University, the researchers looked at the incidence of 4 different Penicillium mycotoxins in silage. They took samples as corn was being harvested and then after fermentation. And they found that only 15% of the samples were free of these 4 mycotoxins. They also found that the frequency and concentration of these mycotoxins increased from harvest time through the fermentation process. Therefore, the mold was growing in the silage and mycotoxins being produced in the silo. The problem with silage is aeration. If we allow air to get into silage, this will produce a yeast growth. The yeast will consume the lactic acid in the silage. This raises the pH of the silage and allows for mold growth, particularly the Fusarium and the Aspergillus. Now, Penicillium mold will grow in the presence of air even if the pH is low. Penicillium will grow at a pH of 4, which would be a normal pH for a well-fermented silage. So in the presence of a small amount of air, we can get Penicillium growth that produces mold and mycotoxins. So when we have a yeasty silage that seems to cause a problem in dairy cattle, perhaps causes off-feed problems, poor rumen fermentation, and oftentimes we've blamed that on yeast or wild yeast production in these silages. it may very well be because of the penicillium that grows in the silage at the very same time, producing any number of different penicillium mycotoxins. There's a number of things we can do to manage mycotoxins. There are some cropping management things like selecting varieties that have some resistance to fungal disease in the field, planting on time and being sure harvest is on time. Certainly we need to manage feed storage like we've talked about with silage. This needs to be managed well so that we have very little air infiltration into the silage. We can remove or dilute contaminated feeds. We can use mold inhibitors such as organic acids like propionic, acetic, or sorbic acid. This will prevent mold growth or reduce mold growth and reduce mycotoxin formation. In some cases, extra nutrients added to the diet can be helpful, particularly additional metabolizable protein. Also, energy and antioxidant nutrients like vitamin E, vitamin A, carotene, and the antioxidant minerals like copper, zinc, manganese, and selenium. We also need to be sure to enhance rumen fermentation because mycotoxins are destroyed in the rumen. And we need to make sure the rumen fermentation stays very active and robust so that we can destroy as much of the mycotoxin as possible. Therefore, feed adequate effective fiber, plenty of buffers, and in some cases we may need to look at microbials to enhance rumen fermentation. The one additive that we look to first when we have a mycotoxicosis is an immune stimulant. Immune stimulants are the yeast cell wall type products that contain glucomannans. These will stimulate immunity and help the animal overcome the depressing effect of mycotoxins on immunity. The second type of product we would look for would be a binder that will bind with a mycotoxin and then prevent absorption by the animal, effectively deactivating the toxicity of the mycotoxin. So in summary, mycotoxins routinely occur in feeds year after year, especially in the forages. The forages provide a diverse array of multiple mycotoxins and some mycotoxins that we never feed to pigs or chickens or other monogastric animals. Now, rumen degradation does help protect the cow from acute mycotoxin toxicity, but if we have rumen upsets, this can allow for bypass of these mycotoxins and a lowering of the degradation of mycotoxins in the rumen. Long-term, low-level intake of mycotoxins produces chronic toxicity. Mycotoxin symptoms are many and diverse, resulting in a cascade of events. And this would be primarily where the mycotoxin reduces immunity and allows other diseases to come into the herd, and we see then the symptoms of those diseases that may come in because of immune suppression. Oftentimes, the symptoms we will notice in dairy herds include digestive upsets, low feed efficiency, milk loss, poor production, poor reproduction, increased disease, and higher culling rates. Disease therapy and vaccines are less effective when a cow is consuming a mycotoxin. Diagnosis is difficult. A mycotoxin cause may not be readily apparent. Mycotoxin exposure then may be an undiagnosed but a key reason for herd health problems. And keep in mind, if you do run into a problem, there are feed additives that can be helpful. The most important of these will be the binders that absorb mycotoxins, immune stimulants, and mold inhibitors. Other management changes can be supportive in the dairy herd, and I do want to remind you that FDA has not approved any binders for the treatment of a mycotoxicosis. Thank you very much. I've enjoyed the opportunity to be with you today and talk about mycotoxins in dairy cattle.